If a person has uneasy feelings that are connected with sympathetic arousal, which psychological state are they experiencing? Alzheimer's, depression, schizophrenia, or anxiety? Uneasy feelings connected with sympathetic arousal.
Anxiety.
That's right. Which one is sympathetic? Fight or flight or rest and digest?
Fight or
Fight or flight. And parasympathetic, para like a parachute, like floating gently to safety, is rest and digest. Yes. Did we have this one before?
No.
I don't think so.
Good. Yeah, please let me know if I start doing questions and it seems like we've had them before. Okay, there's 4 choices here. I only have 2 listed and then the answer. A client comes to a massage therapist with reports of chronic pain. The client states the pain began in his low back 5 years ago after falling off a ladder. He has experienced low back pain ever since and now feels pain in the cervical and thoracic spine as well. The therapist notes the patient is extremely sensitive to touch and feels pain with nearly any touch to the lumbar or thoracic region. What must the therapist consider? The client may have kidney stones. The client may have an acute exacerbation of chronic low back pain. The client may be having a heart attack, or the client may have central sensitization and would benefit from a multidisciplinary approach.
See the B or D.
It's D. It's D. Yeah. B would be a smart guess, but this is an example of a question that depends on you knowing that the word central refers to central nervous system, right? So how stimulus, how information is collected and responded to, and interpretations of things like pain, and then sensitization. What does it mean? What does sensitization mean?
Sensitive, maybe?
Yes, it's when you become more sensitive. And when you become desensitized, what does that mean?
You lost your sense.
That's right.
Sensitivity.
Exactly. You lose the sense or you become less sensitive to something. Yeah. So central nervous system sensitization is a central nervous system that's highly, highly sensitive. Does that sound like like this person? The patient is extremely sensitive to touch and it feels pain with nearly any touch to the lumbar or thoracic region. Now, this next part would benefit from a multidisciplinary approach. How are you supposed to discern that from the description of the patient?
Just by knowledge of it, since he's sensitive, you probably want to use hot rocks or something warm or something cold on it, compression.
Yes, maybe, but from what's written here, you can't really tell that.
Yeah.
So, but still, the aspect of it being the central nervous system and it being sensitized, highly sensitive, and the description of it, person being extremely sensitive, makes D a better choice than B. All right, so hopefully I can give you guys a few recommendations on how to suss out the questions based on that kind of thing. Yeah, go ahead.
Well, the AMTA, we actually done this in like our classroom at school. So I know what you're doing them and taking screenshots, but I don't know if at any point we can go to the website and actually do a test.
Oh, you want to do the FSMTB test tonight?
No. And this is the AMT app, right?
Yeah,
like
yeah.
Well, the website, you can actually go in through the website and do a live test.
You want to try that tonight?
Oh no, well, I mean, I don't want to take up time, but like for next time, just a suggestion.
Well, do you guys want to try that tonight, or do you want to continue with this?
It's up to y'all.
I like this. I don't want to fail.
Oh no, it's
Well, I mean, look, if you Dora, if you want to try taking the live test, I mean, it's totally fine for me to look into it.
Yeah.
This is not like the login that you did for like the actual exam.
No, that's
AMT.
yeah, this is the AMTA app. And the
Right.
login was for the FSMTB.
Right. So this is just like us to like practice, and I like
Right.
actually reading the explanation.
Yeah. But you're interested in doing the FSMTB?
No, not at all.
You want to do the AMTA, a test on the AMTA website
Yeah, because
during the class?
it gives us the explanation, and it says benefits from multidisciplinary approach. So I'm
Yeah.
like, what does that mean? What do they
Well,
mean?
well, the explanation, I say the explanation is here.
Yeah.
In a lot of the questions, but I just didn't record it for this one.
Right.
Because I felt like this was a test taking question solution rather than relying so much on your knowledge of like what a multidisciplinary approach would be, because it wasn't part of the question. But are you asking what is your concern? Is it that there's no explanation? You would have liked to have had an explanation for this question, or is it that these are practice questions and you want to do a live mock test?
A little bit
Or
of
is it
both.
both? A little bit of both. Okay. So
Because I like to see, my thing is I don't know a lot of the words. So
yeah,
when I explanation, I'd be like, oh, okay, so that's what that word means. You know, like I just
you
like to see.
mean like Stephanie was asking, I think, about word breakdowns and medical terminology.
Yeah, what I meant with
Yeah.
that was, like, you know how they say it's like arthritis, like itis, you know, when you see that, you know, it's like inflammation.
Yes.
That I know. But there were some words on the actual exam that I was trying to break down, and I'm like, I don't even know. Like I was trying to break down the words,
Uh-huh.
but I didn't know what some of them were.
Yeah. Okay. Maybe it was you asking me about the word breakdowns. We definitely can go through the words, and you can please ask at any time. If it seems like I'm assuming you know what a word means and you actually don't, just chime in at any time. And I do recommend that you watch the medical terminology video that I made, and there's a presentation, a slides presentation in the MBLEx folder. It's in there under medical terminology right here. So as far as the MBLEx mock exam, I didn't know that there was one on the AMTA website. What I see is that there's a study guide, and the study guide that I'm aware of is the app, and that's what I'm using here.
Yeah.
Is there an exam on the page on the website, or
It's
is it
just
the app?
it's just like the app, but like through the computer.
The app through the computer. Okay. Well,
I could take a look at it later and then kind of like send you the link. We do it in class.
okay.
Well, I don't want to
Okay.
take time.
Yeah. Why don't you send me a copy of where that specific exam is?
Okay.
I'll be using some of the FSMTB questions, like as many of them as I can answer and then screenshot in our classes very soon. And these questions are always worth asking, because there's so many resources and it's confusing, and all of the resources out there will try, in my opinion, wrongly, to convince you that the best way to prepare for the exam is to take as many questions, to study as many questions as possible, to see as many questions as possible.
Mm-hmm.
But in my opinion, that's not the best way to learn to prepare. The best way to prepare is to actually learn anatomy, physiology, kinesiology, and to actually learn the concepts, right?
Right.
That's what I think. Okay, let's move on. But again, you have to study, the rest of the week. Just showing up to the class is not going to be enough practice for you. You have to practice on your own. And I don't want to be mean to you guys, by any stretch, but I do think that you guys should know these kinesiology terms and joint movements, like the stuff we went over in the beginning. You guys, I think, should know those better by now. And the stuff relating to action potentials and muscle excitation, I think you also should know that better, although we did just introduce that recently. But I strongly suggest that you guys make that part of your daily routine. Okay. And there's too much, there's too much. Like I'm trying to play the averages that over like, if we split everything up into, like, let's say if we split all the material up into thirds and we cycle through 1/3, we do 1/3 on every class. I'm trying to play the average that'll give you guys enough exposure to learn 100% as we cycle through things, because we can't do 100% every class.
Right.
So it's just like, I'm guiding you and reminding you and clarifying, but you guys have to actually do the practice and the drilling. All right. Okay. All right, here we go. So when a part of a person's stomach protrudes through the diaphragm, they have a umbilical hernia, hemorrhoid, inguinal hernia, or hiatal hernia.
Hiatal.
Okay. The answer is hiatal. If anybody wants clarification, you let me know. All right. Fill in the blank. Under the direction of a physician, a massage therapist sees a client with a diagnosis of what? Because this client bruises so easily, it is essential that the therapist uses extremely light pressure. So which one of these bruises easily? Pneumonia, anemia, hemophilia, or sciatica?
Hemophilia.
And the answer that they give is hemophilia. Yeah. Blood clotting disorder. Anemia is low red blood cell or low hemoglobin. Which term best describes inflammation of a bursa? Is that tendonitis, bursitis, tenosynovitis, or cystitis?
Bursitis.
Bursitis.
Yep, bursitis. Which of the following is an example of a respiratory infection? Is that anemia, asthma, pneumonia, or phlebitis?
Pneumonia.
Pneumonia, yeah. If an individual is diagnosed with cirrhosis, which part of the body is affected? Esophagus, stomach, colon, or liver?
The liver.
Yep.
Which one? Oh, liver.
The liver, yeah. Where is it?
Any clarification needed for that?
No.
Percussive techniques are an excellent way to stimulate muscle tone. When performing percussion over the lateral aspect of the lower ribs, which of the following structures might be damaged? The liver, the carotid artery, the aorta, or the kidney?
The liver.
That would be the kidney.
What?
So let's look at that. Lateral aspect of the lower ribs. Lateral aspect of the lower ribs. So aggressive percussion to the client's lateral lower ribs risks damage to the kidney. Percussion is sometimes an appropriate technique to use in this area, but should be performed lightly and with great caution. The liver and aorta could be damaged during abdominal massage, and the carotid artery could be damaged during massage inferior to the ear. Okay, so neither of these areas is likely to benefit from tapotment. What does that statement mean relative to the abdomen, Stephanie? Neither of these areas is likely to benefit from tapotment. Relative to the abdomen.
They're not nowhere near there.
It's not an area where you would do tapotment.
Okay.
So tapotment is not on the abdomen, but on the back is what it's saying.
You will do the tapotment on the back. You won't do it on.
That's
You
right.
don't do it on where the liver is.
Yeah, well, I don't think that you would do tapotment on the anterior surface of the body at all.
Yeah, but that's how they are. They don't want the right question. They want the best. They don't want the right answer. They want the best answer. But if they would have put like interior,
Or
lateral,
posterior lateral aspect of the ribs, yeah, then it would be clear.
yeah, they just put lateral.
Lateral aspect of the lower ribs, that's right. And they assume that you know what?
Where all this stuff
They assume that you know where the percussive technique is done and not done.
Yeah.
Yeah. Fill in the blank. Blank is a condition that causes pain in the bottom of the foot and heel, especially upon first weight bearing after getting up from sleep.
Plantar.
Plantar fasciitis, that's right. And the other choices are bunion, Achilles tendonitis, and sciatica. Fill in the blank. A massage therapist is employed by a doctor. Whenever the doctor assigns the therapist a new client, the two colleagues schedule a meeting to discuss the client's health history in advance of massage. In the course of this discussion, the doctor tells the therapist about the patient's what, which is the expected outcome of the patient's illness. Sorry, guys, is it too loud right now?
No.
Okay, good. In the course of the discussion, the doctor tells the therapist about the patient's what, which is the expected outcome of the patient's illness. Symptoms, diagnosis, prognosis, or syndrome.
Symptoms.
Prognosis.
Vincent, what do you think?
Prognosis.
Yes. Can you tell us why?
Prognosis is before this, the the subject before the diagnosis, and it's after this, before the symptoms, after the symptoms have been introduced. I think that's how you say it.
That's right. After the diagnosis, it's after both diagnosis and symptoms, right? You see the symptoms, collect the symptoms, you diagnose the problem, excuse me, and then from the diagnosis, you have, in combination with the patient's health history, you have the prognosis. So, Dora, you were asking about word breakdowns, right?
No, that was me.
No, that was
Stephanie?
Stephanie. Yeah.
Okay,
But
so
I'm with her.
Okay, so prognosis, gnosis means knowing, and pro means before. So prognosis, knowing before, literally means prediction. So you're predicting what's going to happen with the patient's health, the expected outcome, before it happens.
Yeah.
Like, this will resolve in 6 weeks, or this will resolve in a year, or whatever, right? That's ahead of time. Diagnosis means across, knowing across, kind of like if you imagine a field of information or lots of information laid out on the table, you're going straight across all the superfluous extra information to the one piece that is the diagnosis, the one piece that is the cause. And then symptoms are what the patient experiences. So that's subjective. And then a syndrome is a collection of symptoms, just so we have it all. Anyway. Okay. A 15-year-old basketball athlete complains of ongoing pain over the front aspect of his knee. Which condition would be most likely? Muscular dystrophy, lupus erythematosus, bursitis, or Osgood-Schlatters disease? Front aspect of his knee.
Osgood-Schlatters disease.
Well, I would say either bursitis or Osgood-Schlatters disease, right? Because bursitis there's like 4 or 5 bursa in the knee. So what I want to know, Stephanie, is how do you know that it's Osgood-Schlatters in this case? By reading about the patient.
That was actually my instructor at American Institute has this issue, and it started when around that the young kid's age, and she just told us, like, she gave us background on it. So
by the age of the patient?
Yeah, because
Yes.
it started around that time when they're like doing sports and stuff, and she did a lot of sports, and that's when her Osgood-Schlatters disease started.
Yes, and Osgood-Schlatters disease is when the bones grow really quickly and it pulls the tendon away from the bone, and a painful bump, like a bone spur, starts with fluid and then forms a spur, starts to develop. So yes, Osgood-Schlatters disease. Okay, if an individual has, and it's the age of the patient. If an individual has a blood clot within his blood vessel, what does he have? Varicose veins, thrombus, spider veins, or arrhythmia?
Thrombus.
Thrombus, yeah. Thrombus. Fill in the blank. Blank is a condition in which there is an excess of interstitial fluid resulting in tissue swelling. Is that dehydration, edema, atrophy, or hypertension?
Atrophy.
Try again.
Atrophy.
Okay, try an answer other than atrophy. It's not atrophy.
Edema.
Yeah, I think it's edema.
Edema, yeah. It is edema. So what does interstitial mean?
In between.
Yeah, that's right. Very good. It means fluid like in between the cells or fluid in between the tissues.
Right.
Edema, yeah. An older client is scheduled for a session with a massage therapist. At the beginning of the session, the client notes she's feeling lightheaded and having difficulty breathing. Her blood pressure is 170/110. She has never been treated for high blood pressure. What action should the therapist take next? Continue the treatment while frequently asking the client how she's feeling, not continue the treatment and have the client call for her doctor while in the office, not continue the treatment and send the client home, not continue the treatment and have the client, I'm sorry, I didn't record all the possible answers, but it's not continue with treatment and have the client call her doctor. So client's blood pressure reading and other symptoms are consistent with severe hypertension. What is hypertension?
High blood pressure?
Exactly. Because she has not been treated for high blood pressure, this condition is uncontrolled. This is an extremely dangerous condition and a contraindication for massage. It is imperative that the client contact her doctor immediately. By the way, what kind of contraindication is high blood pressure? Is it general or is it specific?
Specific.
So it's actually general because it's systemic, like body-wide. Specific would be something like if someone has like a DVT, deep vein thrombosis, and they have pain in the leg in a specific place, maybe with a history of DVT or recent airline travel, or if someone has like a red area that's right on top of or right around a vein, such as I forget what that's called, but it's inflammation of the blood vessels, then that would be specific.
We'll say like a local contradiction.
Yeah, a local
Something you can see.
Yeah, it's something that's in a smaller area.
Okay.
Or you just avoid like that area, like you can massage the leg, but just avoid the area, like the bruise.
It depends. It depends on what it is. Like, if it's something like let's say it's something that could have, it could be dangerous, then you have to refer the client to a hospital. So things that are dangerous that you can't mess around with at all are signs of possible concussion, which may have some maybe accompanied by bleeding, intracranial bleeding or brain bleeding. So that often looks like, after a knock on the head or some kind of fast movement of the head, like sometimes people get them from spinning really quickly. Like, I don't know if you've ever seen, okay, if somebody has a fall or if they're in a car accident, but they don't hit their head, sometimes the head whips or it moves quickly enough that it actually hits the brain inside the skull, right? So they didn't hit their head, but they had some kind of traumatic thing happen, right? Hockey, soccer, car accidents, hit by a bike, etc., martial arts. And it's accompanied by like no memory of what happened specifically. There can be headache, dizziness, some of their systemic regulation, like their ability to regulate their temperature or sweating may be off, things like that. When in doubt, refer it out. When in doubt, refer it out. But a lot of local stuff that they're going to ask you on the MBLEx is going to be stuff about like skin. It's going to be about eczema, ectopic dermatitis. They might throw a question in there about a local infection. So like if there's broken skin and it's swollen and red and inflamed, what do you do? And the answer is you avoid that area. Right. So some things you just avoid the area, but some things you have to refer to a doctor like right away because there may be a more systemic threat. But for the most part, I think the answer is going to be avoid the area for the local stuff. Okay, so a massage therapist begins seeing a client who has Parkinson's disease. This client takes regular medication for this condition. Given this, what is a potential side effect of massage? I'm sorry, what is a potential effect of massage for this client? Parkinson's disease, takes regular medication for this condition. So they want to know if you understand the effects of the medication for Parkinson's disease. So what do you guys think is a potential effect of massage for someone who takes these kinds of medications? Bruising, dizziness, inability to relax, or excessive drowsiness?
Inability to relax.
I think it's the drowsiness.
I thought it was bruising.
Okay. Okay, so bruising would probably be an effect of blood thinners,
Yes.
like warfarin or Coumadin. And for Parkinson's disease, I think what they use are
They have a shake, right? They have a tremor.
they have Parkinson's is manifests as a tic or a tremor, but it's due to a lack of serotonin, I believe, or maybe a lack of dopamine, right? So those are the drugs those are the neurotransmitters that allow us to be calm or to relax. Those are endorphins. So if you start supplementing endorphins with a medication, putting endorphins in the body, it can result in drowsiness, not the inability to relax. That might be a stimulant. And then dizziness, not sure what would cause that, but this is a good question, a good explanation to read through. So it is excessive drowsiness. All right, dizziness is a potential side effect for clients taking a variety of medications. So many medications, including beta blockers and antihypertensives. Antihypertensives, those are taken for hypertension, which is high blood pressure. Did anybody not know hypertension was high blood pressure?
No.
And beta blockers are often used to correct heart rhythm defects like arrhythmias. Beta blockers. Bruising is especially relevant when working with patients on anticoagulants like blood thinners. Clients using central nervous system medications may have a hard time relaxing. So those are stimulants. So those would be some medications for things like ADHD. However, this is not a direct result of massage. Medications to correct the chemical imbalance of dopamine in the brain. For clients taking these,
Do with
yes,
the medication that they're taking, depending on. Okay.
yeah, it has to do with the type of medication that they're taking. So this requires that you know four different kinds of medications and their mechanisms on the body and some of the effects that massage could have on them. We will be going over different classes of medications more specifically. So this is something we haven't gone over, but you guys already have a lot of knowledge about that. A massage therapist applies pressure to a specific area of the upper right trapezius. When he does this, the client reports pain with this that radiates along her upper arm. What is the most likely direct origin of these symptoms? Pain along the upper arm. Is it a pinched nerve, a trigger point, hepatitis, or radiculopathy?
Trigger point.
Tricky question. Okay, let's see. The answer that they're looking for is a trigger point. And pinched nerve and radiculopathy are one and the same. While this condition can cause radiating pain along the arm, the symptoms would not be reproduced with compression of the upper trapezius. Yeah, so a pinched nerve or radiculopathy, those are the same. And those are caused by compression closer to the nerve root, so closer to the spine. So that might be a herniated disc, or it might be a compression between the vertebrae, or compression between the rib heads in the vertebrae, like a rib head being slightly out of place, or one of those gliding joints, the vertebrae being slightly subluxed. Blank can arise from the stimulation of receptors in the skin, muscles, joints, tendons, and or connective tissue. Blank can arise from the stimulation of receptors in the skin, muscles, joints, tendons, and or connective tissue. Is that somatic? Go ahead.
I'm sorry. I was gonna say visceral
Sorry
pain.
about that.
All right. So is that you guys obviously don't think it's one of these three. So I'll just ask you, is that somatic or is that viscera?
Visceral.
Skin, muscles, joints, tendons, connective tissue. Does that sound like viscera?
It should be somatic, right?
Should be somatic. That's right. And why would the answer, Victor, not be muscle? Why is somatic a better choice than muscle?
Because there's stimulation. I'm
Yep.
sorry. Yeah, so stimulation means it's the sensory part.
Close, but not quite. It's
Oh.
because muscle is one part of all the somatic structures, and all these somatic structures are listed in the question. So somatic includes muscle. Somatic includes muscle, right? So this is the better choice because it includes B, includes muscle. Somatic pain. Somatic pain can arise from the stimulation of receptors in the skin, muscles, joints, tendons, or connective tissue. Muscle pain is just one example of somatic pain. Phantom pain is experienced in a limb or other body part that has been amputated. Visceral pain is pain of the internal organs or viscera. Internal organs or viscera. Fill in the blanks. A client with a heart murmur has a heart that has abnormal contractions, a heart that beats irregularly, a heart that receives decreased blood due to a blocked artery, or a faulty heart valve.
Faulty heart valve.
That is correct. Does anyone not understand this? Heart murmur is the result of a leaking heart valve.
No, I have one.
Oh, okay. All right.
That's why I get that one right when it comes up.
All right. Which of the following underlying structures could be injured during massage to the ulnar notch? The ulnar notch. Which structure? The brachial plexus, the carotid artery, the ulnar nerve, or the subclavian artery?
Brachial plexus?
Brachial plexus is in the neck and upper and like deltopectoral triangle area, so front of the chest.
The ulnar nerve then, because
It's got to be the ulnar nerve because the carotid artery is in the neck, subclavian artery is around the clavicle. Ulnar nerve. Looks like that's all that I have for you for pathology for these questions. I think I may have another set of patho questions in here. Pathology contraindications. Let's see what this one says. Oh yeah, this is oh yeah, there's a few more here. Okay. So okay, I've indicated the answer, but we could still go through it. So an athlete is running and suddenly steps on an unexpected rock and rolls her ankle, which results in immediate pain. What system does this predominantly activate? Predominantly, in bold letters, activate. Is it the sympathetic nervous system, parasympathetic nervous system, the enteric nervous system, or the central nervous system? So it's sympathetic because why, Dora?
I'm not sure, to be honest.
Okay. Okay. So when they word a question, try to look at the words in the question. So steps on an unexpected rock. So what does it feel like when you have an unexpected thing happening while running?
It's a sudden thing,
Sudden thing, which is
sudden movement.
yeah, kind of shocking, right?
Mm-hmm.
Or scary or similar, right? So that's sympathetic nervous system, right? So sympathetic is fight or flight. Parasympathetic is rest, digest, attend, and befriend. Like like parachute. Enteric means what, Stephanie?
Enteric.
Yeah, enteric.
Oh.
This is the third nervous system of the body, the third nervous system. It's the brain of the gut. So it's the wiring of the digestive system. It has its own timing, its own rhythm. That in part is why our stomach growls. We get ready to digest at the same times every day. And it's why we feel full, because we have a nervous system in there that tells us when our organs are distended and full of food. Enteric nervous system. And then the central nervous system, that's the central nervous system, right? Compared to the peripheral nervous system. By the way, Victor, the sympathetic and parasympathetic nervous systems, they're two branches of which part of the nervous system? Central or peripheral? It's also called the sympathetic branch and the parasympathetic branch. It's the peripheral nervous system.
Peripheral.
Yeah, peripheral. Yeah. Okay. A client informs you that he is taking omeprazole, brand name Prilosec. What type of health problem is he most likely to have? What type of? That's right. And Prilosec or omeprazole is specifically for what symptom?
Stomach issues.
Yeah.
Gastritis or something.
Gastritis. GERD, gastroesophageal reflux, heartburn, reflux. Yeah. Okay, just one more. Fill in the blank. The anterior triangle of the neck is considered an endangerment site because it contains all of the following structures except for jugular vein, carotid artery, vagus nerve, or the brachiocephalic artery. Which one is not in the anterior triangle?
Brachiocephalic?
I believe so, yeah. Did we look at the anterior triangle yet?
No.
Oh, we didn't look at that? Okay. We should look at that next time. But yeah, all these structures here are in the are in the anterior triangle. Okay, guys. Good work today. As usual, if you have any feedback for me, or if you want to suggest like places where resources I might consider that you want me to consider bringing into class, just put it in the chat, put it in the group text, and I'll take a look at those. All right.
All right.
All right.
All right.
Try to look at some common medications for the next class. I will see if I can give you some specifics, ask you some specific stuff like I have been, or point you in the right direction for Thursday. Okay.
Okay.
All right.
All right. Have a great class. Have a great couple days.
Thank you.
Okay.
Good night.
You're welcome. Good night. Bye-bye.